Hi, and thanks for logging on to the Daily Dvar halacha. And here's a brand new halacha for you, and it's for Monday, the 16th day of June. Here we go. We're continuing on a bunch of laws that Rabbi Neustadt put together on medical things that you're allowed to do and not do on Shabbos. What if a person, God forbid, needs stitches for a wound on Shabbos? So the general rule is you should know that stitching on Shabbos can involve a biblical avera, a biblical sin. Therefore, stitching is considered a pretty serious thing to do, and therefore, if stitches are necessary on a minor wound, then it is best that you try to have a non-Jew do the stitches. If, however, the wound is very serious and it's possibly life-threatening, then you are allowed to have a Jewish person also do the stitches. But if it's minor, then you're only allowed to have a non-Jew do the stitches for you on Shabbos. If a person is suffering from stomach cramps, if they're mild, then he's not allowed to take any medicines. He's allowed to take foods that may soothe it, like prune juice or whatever. Those things are allowed because they are foods, but medicines are not allowed for mild cramps. What you could do also is put a hot water bottle on it. If the pain starts to get very strong, then you could use a hot water bottle. Also, if the pain starts to get very strong, then medicines would be allowed. So you may want to speak to a good posek if you feel you're kind of like in between. Because for severe stomach cramps, then medicines and things are allowed. For strep throat, all oral medications are allowed if a person is suffering from strep throat. I think we mentioned this earlier, but I'll just say it quickly again. If the strep is pretty much gone, but you're on a 10-day regimen of antibiotics, and Shabbos is, let's say, day number 10 or 9, you still complete your medicine all the way, because that's the way antibiotics work. They will only do their job if they totally eradicate the infection, and you have to go to the end of what the doctor prescribed on things like strep throat. If a person has mild sunburn, no medications are allowed in that situation. If it's severe, please speak to a posek, because severe, could get into other complications. But normal, ordinary sunburn, which you wouldn't call severe, so medications are not supposed to be used. If a person is uncomfortable from perspiring, from sweating, then the one thing that he's allowed to do is to sprinkle things like baby powder onto the areas that are sweaty, but that's about it. If a person has some swelling, then the halacha is that he's allowed to press a cold knife on the swelling to cause the swelling to go down. He's also allowed to wash or soak that area that's swelling to try to get the swelling to go down. And he's also allowed to use ice, straight out of the freezer, or even a cold something out of the freezer as a compress to help the swelling go down. I hope you're not getting tired of this. I think we're going to do this for one more day tomorrow. Thanks for logging on, and log on again tomorrow for more. Bye-bye.